First week of October marks the 10th annual International Plasma Awareness Week.
And although many have heard of plasma donation, a lot of us remain unsure of what it is or why it's needed. To tell us more about the important impact of donating plasma, hematologist oncologist Dr. Claudio Sandoval, Director of Scientific and Medical Affairs at Octapharma. And we also have Shannon Bauer, a patient with primary immune deficiency and also an Octapharma patient educator. Good morning to both of you. Thanks for being with us.
Good morning. Thanks for having us.
Good morning. Thank you so much.
So, Doc, first to you, can you tell the folks what plasma is, the difference between blood and how it's used to save lives?
Sure. So plasma obviously comes from human beings. So that's the key point. We really need to understand that plasma comes from humans. And plasma is the component of blood that has all the life-saving proteins, the immunoglobulins for infections, the factors for bleeding disorders, other enzymes and proteins to keep us alive. And it's different from a regular blood transfusion in that the blood is actually collected, put into a machine, the cells are put one way, the plasma is collected, the cells are returned to you, and that plasma 6 months, 12 months later becomes a life-saving medication. And I really want to kind of emphasize that this is coming from humans and it's a life-saving medication.
And Shannon, you were diagnosed in 2014 with primary immune deficiency. How did that diagnosis change your life, and what were your treatments like?
The diagnosis gave validity to the fact that I was getting sick all the time. I was getting sinus infections and bronchitis and pneumonia every 3 to 4 months. And I was like, my gosh, what the heck is going on? And once I got diagnosed, I had a reason why I was getting sick. And then the treatments allowed me to be able to go out in public and work a job and not worry so much that I was going to get sick all the time. So it changed my life drastically. And I'm so grateful for those individuals who continually go and donate plasma, because it helps me and allows me to have a life.
Yeah, and doctor, how has the pandemic impacted donation rates? I mean, we've heard that blood donations are down. So what's the situation for plasma?
Well, the same thing for plasma. You know, the pandemic has caused a drastic decrease in the number of folks going out to donate plasma. And with plasma having a lag effect of about 6 to 12 months from donation to making a life-saving medication, we tend to get the effect later on. So we really encourage folks to go out there, donate plasma, know that you're saving a life. I think that's the most critical component of donating plasma. Know that you are saving someone's life.
Absolutely. Yeah. So important. And Shannon, you're proof of the importance of plasma donation. What's the process like for someone who's considering donating?
When somebody wants to consider donating plasma, the first thing they should do is go to octapharmaplasma.com and look up the local donation center in your area. And then what will happen is they'll make an appointment and you'll go down, and the first appointment takes about 2 hours and the ones after that are about an hour. And the first appointment, you're going to have a physical, they're going to check you out, they're going to have you answer some questions, and then they'll take you back and allow you to donate your plasma once you check all the boxes off with that. And what's really amazing about that is when I was first diagnosed, I used to think that my medicine came from fairies, and it doesn't. It comes from people just like you and I who take the time to reach out and do something amazing for somebody like me. And I am grateful for these people and extremely humbled that you would do this week in and week out. So thank you all very, very much.
It's a great message, and I know that gratitude goes a long way to inspiring more people to donate. Hey, doctor, where can folks go to learn more information about what we just talked about?
Yeah, sure. So the best site would be to go to octapharmaplasma.com. And as Shannon said, they will provide to you all the information you need. And we really need folks to go out and donate. And I too thank you all, because I was actively taking care of patients whose lives depended on plasma donations. So please go out there and get your family members and friends to go out and donate plasma.
Yeah, that is the message today. Hematologist-oncologist Dr. Claudio Sandoval, Director of Scientific and Medical Affairs at Octapharma, and Shannon Bauer, a patient with primary immune deficiency and Octapharma patient educator. Thank you both for being here with us and shedding some light on this very important topic. We appreciate it.
Thank you so much.
Thank you very much for having us.